So I would invite the man who's come to see me to tell me about his work. What's he proud of? What has he done that he remembers that is very significant to because it's healthcare, to the betterment of patients? How has he functioned well in the past as one of the team members? And because I also work in an academics setting, is there some research he's involved in? Is there an article he's written? I would just ask them for the perhaps first hour, so tell me about the positive experiences of your life. Because I do not want to add to the shame. And that means I can go back to those periods in their life where it wasn't like this. And it can actually be almost like a resource installation, right? Installation of helping them feel better and having a reference point that I can go back to. So I would never begin with the downside of their life. Unless, of course, my sense is that they're severely depressed and suicidal. I mean, that's another course.
Figure out where their mojo lies, and where is their mojo? How do you activate it again once it's gone? So, really trying to establish a relationship with them based on, almost as if having the office just disappear. Having yourself be in more casual attire, connect with them, figure out what their hobbies are, relate to them. So, I think that's one of the biggest challenges. When you're working with men for a long period of time, you may see patterns. Somebody coming in, fist clenched, head down, and looking away, irritable, angry, they're not buying anything you're saying. So having the ability to completely take away the assessment piece and just say, what do you like to do? What's fun? What do you do on Friday afternoon after work? Just doing it from a perspective of completely avoiding any kind of clinical question.
Well, I think that rapport building is important with all patients. When I have someone, though, come into the office and I sense this is the first time that they've talked about their emotional state, and I sense that they're very cautious about that. Sometimes what I'll do is actually change the way that I go about asking my questions. So I had a fellow come in the other day, and in the first 5 minutes he said to me, "You're going to ask me lots of questions. I'm probably not going to answer all of them. And if there's something that you ask me that I don't like, I'm leaving. I'm going to walk out." So I knew right off the bat that I had to work on rapport building for this individual, and that I was going to get nowhere in terms of asking any of his depressive symptoms if I didn't spend the time to do that. So in that case, I spent more time actually on his social history and trying to get to know him as an individual before I even went into depression and asking the more kind of sensitive questions. So I think that we have to be flexible and adaptable, and I think that we have to be genuine ourselves, because I think our patients are aware when we're not doing that. So you have to be yourself and be inquisitive and be empathetic and be adaptable in how you go about getting that information.